Hello, I'm D. Scott Smith, an infectious disease specialist at the San Mateo County Public Health Hospital in California. I'm presenting this course, Leptospirosis, a Clinical Perspective, as part of Invisible International's Medical Education Initiative. This program, which includes a large library of free CMEs, is generously supported by the Monte Calvo Family Foundation. Leptospirosis, a Clinical Perspective. Case recognition, One Health, and spirochete disease comparisons. Leptospirosis is a zoonotic disease with growing global relevance due to overlap of mammals that carry leptospirosis with human habitat. Leptospirosis is important in primary care as that's where most cases are first seen. My disclosures, I have no relevant conflicts or disclosures for this topic, but you see below my affiliations, consultancies, and advisory boards. The objectives of this talk include to identify the epidemiologic risks for acquiring leptospirosis, describe transmission of leptospirosis, and consider, recognize, and diagnose leptospirosis. We'll cite the limitations of current diagnostics. The causative agent of leptospirosis is an obligate aerobic gram-negative spirochete bacteria. There are many species of Leptospira found in many species of mammals, including rats, dogs, cows, and many others. Leptospirosis is endemic in over 100 countries. People at risk include triathletes and humans who are exposed to fresh water in flooding zones. I have listed on the right here the state prevalence by order of observed cases. Hawaii and Puerto Rico and Florida are the top 3 places of the 10 states listed where leptospirosis is observed. This map shows a heat map of leptospirosis epidemiology worldwide from PLOS in 2015. You can appreciate that most cases occur in the warmer countries, but it does happen in temperate zones as well. Since leptospirosis isn't a reportable disease officially, this data is hard to come by and is somewhat spotty. There's a wide geographic distribution with Southeast Asia, Oceania, the Indian subcontinent, and Caribbean and Latin America considered as highly endemic. The estimated incidence by zone, temperate climates show about 0.1 to 1 per 100,000 people. Tropical climates a little bit more at 10 per 100,000 people. And when it's an epidemic, there can be as many as 100 cases per 100,000 people while epidemics are underway. This is a list to illustrate the occurrence published in the MMWR, the Morbidity Mortality Weekly Report published by the CDC. And you can appreciate in the last 10 years, there have been cases about hospitalizations, deaths, and specific outbreaks most years. There is a One Health connection, and this is illustrated by the diagram showing the interconnectedness of human, animal, and environmental health. This shows that the free-living Leptospira, the spirochete, from rats or many other mammals can contaminate water, mud, and soil. And then when humans are in contact with that via many activities, including planting, hunting, gutting, canoeing, weeding, etc., then they're susceptible to getting this disease. Transmission and incubation happens primarily through contact with animals. And these, as we discussed, are mammals, including rats, dogs, and cows. But it's the contact with contaminated water or mud that leads to the actual infection in humans. The incubation period is usually 7 to 10 days, with a range of 2 to 30 days observed in practice. The clinical presentation is fairly nonspecific, but the signs include fever, jaundice, and a mild rash. Symptoms include myalgia and headache, and the spectrum of disease when it presents is mild to very severe or even death. The labs most commonly observed in nonspecific general labs that are abnormal are usually the creatinine and transaminase levels acutely within the few days of presenting with symptoms. Those are observed to be abnormal. I'm going to go through a case scenario with several cases. This is reported in the Emerging Infectious Diseases Journal put out by the CDC, entitled Fever of Unknown Origin After a Houseboat Vacation in California. The case was of CA, a 35-year-old Caucasian man who presented to an urgent care clinic twice with myalgias and fever up to 103 degrees Fahrenheit. He also noted headache, photophobia, nausea, and anorexia. On physical exam, he had a subtle rash and conjunctival suffusion, but there weren't many hints on physical exam of this specific disease. This shows the conjunctival suffusion. It's characterized by redness of the conjunctiva, resembling conjunctivitis. But the interesting different thing about it is that there are no inflammatory exudates. 10 days ago, this patient returned from a houseboating and swimming vacation on the New Melenis Lake Reservoir in Tuolumne County, California. He was admitted with mild hepatitis, renal insufficiency, and his creatinine increased daily to peak at 4 grams. Related cases to his presentation, CA reported that 2 of his friends who had accompanied him on the houseboat were also ill. RP was a 38-year-old man presented 4 days later to a nearby facility with myalgia and a fever at 100.2. He complained of tea-colored urine, chills, headache, nausea, and anorexia, and he was admitted with oliguric acute renal failure, and his creatinine peaked at 17.3 mg per deciliter, and he actually went on dialysis. A third friend was also hospitalized with similar symptoms at a third facility. The 3 ill subjects were the only ones who swam in Wolf Gulch, and 5 of 8 people on the boat who remained healthy did not swim in the cove below Wolf Gulch. A renal biopsy showed interstitial edema, focal tubule necrosis, and inflammatory infiltrates. Lymphocytes with scattered eosinophils and neutrophils were characteristic of acute tubulointerstitial nephritis, as seen here on this piece of kidney. The close-up showing the stains, including the eosinophils, is here. And then special immunostaining was done, and you can see in the middle panel B that there were fragmented leptospires shown by the arrows, revealing the bacterial antigens in the staining. This was from the second patient's renal biopsy that was sent to the CDC for special study. The lab values comparing 2 of the 3 patients who were hospitalized for this illness show that the white cell counts were normal for both CA and RP. And the only actual abnormal tests that are nonspecific included the creatinine and the ALT. So CA had a peak of 4 mg per deciliter, and RP had a peak of 17.3, and he went on hemodialysis, and both had elevated transaminase values. So there was an investigation because the treating physicians from all three Redwood City hospitals initiated a public health inquiry to investigate potential environmental risks. The state veterinarian, local county public health officers, university researchers, and the sheriff's department all organized to better define the origins of this disease outbreak. Here we are trekking up Wolf Gulch at New Melones Reservoir, collecting environmental samples for the causative agent. You can appreciate the sheriff there on the left didn't have personal protective gear, was wading in the fresh water, which is potentially at risk for transmitting leptospirosis. This is a picture of cattle right above that Wolf Gulch, and these are the animals suspected of potentially harboring leptospirosis at that time. Samples of the environment were obtained, but no specific smoking gun was identified. The differential diagnosis for leptospirosis includes a variety of infections, influenza, dengue, hantavirus, yellow fever, rickettsiosis, borreliosis, brucellosis, malaria, and pyelonephritis, and aseptic meningitis, and even chemical poisoning should be considered when leptospirosis presents. The signs and symptoms include high fever, conjunctival injection, headache, chills, myalgias, abdominal pain, nausea and vomiting, diarrhea, jaundice, and rash. You can appreciate from these very nonspecific symptoms that it's not easy to make the diagnosis. So high clinical suspicion based on exposures to fresh water and the epidemiology, where you are and what time of year, and maybe even considering animal exposures are all important variables to actually clinch the diagnosis. The transmission occurs from exposure of the skin by microabrasions or mucosal exposure to fresh water that's contaminated by the feces or urine of infected mammals, most commonly rats, but also dogs and other farm animals. The diagnosis is made by antibody tests that the antibodies developed 3 to 10 days after onset of symptoms. Negative tests collected in the first week after symptom onset do not rule out leptospirosis and should be repeated 7 to 14 days after the first sample is sent, so that convalescing changes in observed titers can be made and help with making the diagnosis. Leptospira are present in the blood. That's septicemia for the first 4 to 6 days of illness and may be shed in the urine intermittently after the first week of symptoms. So timing is critical to make the diagnosis, and repeated tests sent throughout the illness should be considered in order to more definitively make the diagnosis. And the best test may be the one that's available or can be done expediently. And often this testing may come in a panel with other diseases. For example, syndromic panels made by BioFire or Carriers or other commercial testing companies. Talk to your lab or public health contact to order the best test based on timing and other clinical suspicions. Some of the limitations to consider with the various available testing. First of all, microscopic agglutination test, the MIT, is the gold standard test for leptospirosis. It detects antibodies in the blood, and the MAT is a complex test that requires specialized training to perform. It's not available in all laboratories, but note that it's the serologic reference standard that the CDC uses. Polymerase chain reaction tests. This is a molecular test that detects the DNA of leptospires in the blood or urine. And PCR testing is a sensitive test, but not always specific. And lastly, enzyme-linked immunosorbent assays, or ELISAs, are a cornerstone test that can be done for leptospirosis. And this is a blood test that detects antibodies to leptospires And the ELISA is simpler and more commonly used than the MAT, but it's not as specific. And this means that it can produce false positive results. And again, doubling down on the CDC recommendations, if available and if possible, the MAT test should be used as a confirmatory serologic testing in the right time frame. So samples collected 7 to 14 days apart and after start of symptoms. Um, the polymerase chain reaction, the PCR test, is available through many commercial labs, and the recommended samples to send it on include whole blood, urine, and CSF. And then lastly, as illustrated in this case series, pathology, particularly of kidney tissue, if possible, is another diagnostic approach. And formalin fixed tissues, especially from the kidney, but also you could use liver, lung, heart, or spleen, can also be useful to yield a diagnosis. What about prevention? Avoid exposure to fresh water after heavy rains or flooding. Wear protective gear, rubber boots, protective coveralls, clothing, and gloves, and treat unsafe water chemically or by boiling before exposure. And treat and pest control, especially rodents in the context of flooding, are all important strategies. Another prevention modality is doxycycline prophylaxis, 200 milligrams taken orally weekly for high risk individuals if exposure is unavoidable. And lastly, note that there is no vaccine for humans, but there are vaccines available for both dogs and cattle. What about reporting and surveillance? The CDC has a reporting infrastructure in place, but it's a nationally notifiable, not reportable disease by requirement. So many of the reports that we see come in through local government entities to the CDC, but since it's not required reporting like many other diseases, the epidemiology is of less certainty. So if you can report confirmed and probable cases via your state and public health departments. What about comparison of other spirochete diseases? Here's a list of 5 spirochetes, including leptospirosis, syphilis, Borrelia burgdorferi, which is Lyme disease, and relapsing fever or rat bite fever. All are caused by bacterial spirochetes. This is a table showing some of the commonalities between them. They can be related to animals. In the case of leptospirosis, a variety of mammals. They can be transmitted by tick bite, sexual contact from other humans. In the case of syphilis, a louse infected bite, or a rat bite in the case of Streptobacillus monoformis. Another commonality of these spirochete bacterial diseases is that doxycycline is a common thread in terms of good treatment for these bacterial spirochete diseases. Here are some summary facts as a final review about leptospirosis. The most widespread zoonosis in the world is leptospirosis. It's rarely diagnosed in the United States, and it's likely underdiagnosed because it's not officially reportable, but rather just notifiable to the CDC. It's a re-emerging infection, and both rural and urban cases are on the rise. Worldwide, there are an estimated 1 million cases and 60,000 deaths annually caused by spirochetes from the genus Leptospira. And it's transmitted via contact with urine from chronically infected carrier animals, especially rats, but also dogs and livestock. Transmission occurs from contaminated water or soil when the bacteria enters the mucous membranes or microabrasions. of somebody coming in contact with fresh water. Signs and symptoms are very nonspecific, but include fever, myalgia, headache, nausea, and vomiting. Acute tubular interstitial nephritis is the most characteristic renal lesion of leptospirosis, leading to acute renal failure. Leptospirosis can progress rapidly to renal and hepatic failure, myocarditis, respiratory distress if untreated. And the treatment is with doxycycline, 100 milligrams twice a day for 10 days, or with penicillin. Leptospirosis deserves to be considered in febrile patients with consistent presentations and a history of freshwater exposure. Here are the references for each of those listed summary points. And there are also some further general references available for you. Thank you for your time, and I hope you learned a lot about leptospirosis today.